My first question for you, Dr. Asti, this morning is, why do women with PCOS have a very high AMH?
Okay, so really the AMH level and how long women stay fertile in terms of the egg reserve depends on how many eggs they're born with. Yeah, so if women born with very high number of eggs, and they stay fertile longer and they have a late menopause. If women born with a low number of eggs, they lose their egg reserve quickly and they can have a premature ovarian insufficiency, early menopause. So, and that's genetically determined. So there's a gene which is responsible for number of eggs, creation of eggs in the ovaries. So all the eggs are created before women are born. After the birth, women cannot create eggs. Unlike men, in men, they can keep creating sperm throughout their life, but women create the eggs before they are born, and they only can activate and spend those eggs. So if a woman born with a very high number of eggs in their ovaries, so they have a very high egg reserve, which can be measured by AMH and antral follicle count, AFC. And this is a group of women who have a PCOS later on. So after they go through a first menstrual period during teenage years, then gradually they develop PCOS because they have a very high reserve, lots of follicles any given time on their ovaries. And when you scan, you can see more than 20 follicles in each ovary. You see more than 40 follicles generally. So, and those follicles keep producing AMH hormone, and that AMH stops them from ovulating. So, like we said yesterday, AMH has got two roles. One is to stop activation of sleeping eggs. AMH preserves your fertility until the age of menopause. And the second role of AMH is to stop ovulation of multiple eggs every month, so that one egg gets ovulated. This is the second role, is responsible for anovulation in PCOS. So how it does, so this is why women with PCOS, when they're young, let us say in their 20s, with severe PCOS, they do not ovulate. And they have period every year, maybe every 6 months. If you measure their AMH, it's very high, like 70, 80, maybe even more than 100 picomoliters. And when you do scan, they can have 60, 70, 80 follicles on their ovaries. So what happens is once their egg reserve drops, because they're getting older, naturally it drops for everyone. So once this tide of follicle number and AMH drops, then they start suddenly ovulating. Yeah, some women, depending on how much of egg reserve they had to start with, some women start ovulating at the age of 25, next one 28, 30, 35, 40. Some women start ovulating with PCOS after the age of 40. Paradoxically, if they try to conceive naturally, they are more fertile when they're older. So older women get less fertile as they get older because their egg quality egg quantity drops. PCOS patients, if they don't use any fertility treatment, if they just wait to have a natural conception, they start ovulating later. Yes, their egg quality drop, but compared to their previous fertility, when they were not ovulating, they become more fertile later. Why? Because they start ovulating. Why they start ovulating? Because the AMH drops. Because the antral follicle number drops, then they start ovulating. So women with PCOS have a high AMH because they were born with a very high number of eggs on the ovaries, and then those eggs, like we said yesterday, if you have a high number of follicles in sleeping eggs, you have high number of active follicles. We call preantral and antral follicles. Those follicles produce AMH, and then they have a high AMH levels. So PCOS women are the women who have a very late menopause. Everyone heard women menstruating until the age of 60. Some women have a menopause as late as maybe even at 65. So these are the extremes of PCOS women who are having menstrual period even like at the age of 60. Average age of menopause is approximately 51, 52. So anyone who has a menopause after the menstrual period after the age of 55, these are women who are born with extremely high number of eggs. Then they develop PCOS later on, and they have a very late menopause. So I will explain how AMH stops ovulation. So there is something called AMH FSH barrier. So what happens is the follicles we call antral follicles, when you do AFC scan, you count those follicles, produce AMH hormone. If you have very high antral follicles, let us say you have PCOS, your antral follicle number is 60 and your AMH level is 85. So you have got so much AMH in the system. So what happens is every month your pituitary gland, the gland on the base of the brain, produces all the time two hormones, FSH and LH hormone. The role of FSH hormone is to stimulate those follicles to get them through activation to growth stage. Growth stage means more than 10 millimeters. Any follicle smaller than 10 millimeters is called antral follicle. A millimeter is called antral follicle. So under the influence of FSH, so one of the follicles should get bigger than 10 millimeters and should ovulate. So once it becomes 16, 17, 18, 19, 20 millimeters, then LH, second hormone of pituitary called LH, gets released. You have very high LH levels, which is ovulation hormone. Then it breaks that follicle and ovulation happens. So if you have a normal level of AMH, normal number of antral follicles, normal level of AMH, so let us say your AMH is like normal, which is like 20, for example. So you have got approximately 20 follicles, you have AMH is 20. So when pituitary is producing FSH hormone, which crosses the barrier of AMH easily, which means it selects one follicle, that follicle grows and your pituitary produces LH, you then have ovulation. When your AMH is so high, which means your antral follicle number is 60, AMH is 85, so you produce FSH normal level, it cannot reach that barrier. So AMH suppresses all the follicles, so it cannot select any. Then FSH drops. Then LH stays high. In women with PCOS, it stays high. LH is also trying to cause ovulation, but it cannot reach that level. Why? Because the estrogen is not being produced in high levels from the selected follicle. So that's as a result, you have anovulation in severe PCOS. If you have a severe PCOS, you have anovulation, which means you may even amenorrhea, which means you don't have even menstrual period for 6 months. If you have a little bit lower egg reserve, you have ovulatory PCOS, which means you have a PCOS but you ovulate. So then once it drops, even PCOS symptoms go away and your ovarian reserve becomes normal. Let us say at the age of 25, you had severe PCOS, you didn't ovulate. At the age of 30, you have ovulatory PCOS. At the age of 35, all PCOS symptoms gone. Now you have a normal ovulation until you have a menopause. So how we make women ovulate with PCOS is by giving letrozole or Clomid. So let us say same patient, antral follicle is 60, AMH is 85. Then when you give a letrozole or Clomid, what it does is it makes pituitary to produce more FSH, so that FSH will cross that high barrier. It doesn't drop the barrier of AMH or AFC, it stays high, but FSH increases, then it manages to select one or two follicles for ovulation. In some patients, if they have such a high egg reserve, very high AMH and AFC, even letrozole Clomid doesn't work. You keep increasing the dose, 1 tablet, 2 tablets, 3 tablets a day for 5 days, still doesn't increase FSH sufficiently to cause ovulation. Then what you do, you give them FSH drug directly, like Menopur and Gonalev, Purigon, directly to increase FSH high enough so that FSH will cross that AMH barrier and let's select one dominant follicle or two dominant follicles. Even if that doesn't work, because if you give a high dose, then they can overstimulate. You don't want women to have 4 or 5 eggs release, at the time of ovulation induction. The next option is IVF. In IVF, you give a very higher dose FSH, let us say 125, 150 units. Even if they release like 10, 15 follicles, you collect them and create the embryos, put one embryo back in, so which means they can't have a twin pregnancy or multiple pregnancies. So yes, so in PCOS, we achieve ovulation in patients who are not ovulating by giving letrozole clomid FSH, because it allows us to cross AMH barrier. So essentially, yes, answer to the question why women with PCOS have a high AMH, because they are born with high number of eggs. They have a high antral follicles. All these antral follicles are producing AMH, and that's why they have a high AMH, and they have a longer fertility, and they have a late menopause. So the gene responsible for creation of number of eggs you have runs in the families. That's why PCOS runs in the families. If you have anyone in the family in PCOS, you are more likely to have a PCOS, and you have a longer fertility in terms of your egg reserve. I'm not talking about quality and other cause of fertility, from purely egg reserve point of view. Let us say average number of eggs women born with is 500,000. We think it's we don't know exactly, but we think it's 500,000 eggs. Women with PCOS may be born with 2.5, 3, 4 million eggs in the ovaries. Women with a low egg reserve are born with less number of eggs, maybe 100,000 or 200,000 eggs. And this is why by the time they try to conceive, if they delay their plans, they can run out of egg reserve. Then this is a women who need donor eggs to achieve successful pregnancy.